Hello, I'm Chris Stout, a vascular surgeon with Ozark Regional Vein and Artery Center. Today, we're going to discuss uterine fibroids. Uterine fibroids sounds really scary, but it's a tumor, which sounds even more scary, but it's a benign tumor, meaning it's not cancerous. It does not spread or go anywhere else. Fibroids are more prevalent in women that are premenopausal, so you see them a lot in their 20 to 40-year-old age range, and generally they're due to benign growth in the uterus, exposure to different hormones, and over time they grow and they can cause some severe symptoms. Uterine fibroids suck up a lot of blood in the uterus, and what that does is it can cause excessive bleeding, cause excessive pain in the pelvis, and even some things that we've helped some patients that have developed some pretty severe symptoms with relationships with their spouses. We are able to go from the patient's wrist, and I can go from the wrist and snake all the way up and then back down the aorta, down into the pelvic arteries, and then I find the little branch of the artery that goes to the uterus. And once we select that artery at the uterus, we put a long catheter down there, very similar to this long catheter that goes from the wrist all the way down. Through this catheter, we're able to inject this substance right here. These are called embospheres, and they're between 400 and 800 microns. Those are the sizes that we use, and you inject them in there. And remember how I mentioned that the fibroids preferentially drink a ton of blood? Well, these things preferentially flow to the fibroids. Some of them will go to the uterus proper, so that causes some pain for a couple of days. But as these little tiny spheres go in and they clog up the artery to the fibroids, well, those fibroids slowly die and shrink up. After a few days, the pain usually resolves and the patient can get back to their normal life. Overall, I tell my patients, give it about 3 months to see a significant amount of shrinking, but they continue to shrink for up to 6 months, even out to a year. So I tell my patients, you may not notice much in the first month or two, but at 3 months you should notice a significant, drastic change in your quality of life and your symptoms. If you have any further questions, be sure to give us a call, log on to our website and request an appointment. We'll be more than happy to see and take care of you.